why is the diagnosis of pigmented tumours so difficult? And it's recognised as one, or if not the most difficult area for pathologists to make a diagnosis. And for many types of cancer, pathologists can look down the microscope in a millisecond, often can make the diagnosis. They know, is a tumour benign or malignant? What's going to happen to the patient? The challenge for melanocytic tumours is that benign nevi and melanomas can share many pathological features. So individual features that you can see in one tumour, you can see in another tumour at times. And to make a diagnosis, the pathologist needs to assess a range of architectural, cytological features and features of the host response, as well as correlate it with clinical information, including the age of the patient and the site of the lesion, whether there's been previous trauma to the lesion, and other clinical information to land on a particular diagnosis. And it's because of this overlapping range of features that causes particular challenges in making the diagnosis of pigmented tumours. The other thing I wanted to raise was that over the last decade or so, it's become clear that the traditional classification of pigmented tumours as either being a benign nevus or a melanoma is too simplistic. To change from a nevus to melanoma, the melanocytes, or the cells that make that form a melanoma, they undergo a stepwise accumulation of molecular events that cause the transformation to occur. And it's not just one feature that makes the transformation from a nevus to a melanoma. And in fact, we now recognise that there's a group of tumours that sit in the middle, an intermediate group of tumours which have been termed melanocytomas in the WHO classification of skin tumours in the 4th edition and coming up in the 5th edition. And the idea of this group of tumours is that they truly are biologically intermediate. Most of them, the overwhelming majority of them, behave in a benign fashion, but occasionally they spread to regional lymph nodes, and very rarely they extend beyond them.